for staying with us. It's 6:15, and in this morning's Health Beat, imagine living out your childhood knowing a kidney transplant was inevitable, with no idea when you're going to need one. That's a reality for two Fair Oaks teenagers now in the search for a perfect match.
Yes!
Livia and Maddox Ventura are typical teenagers. Maddox, a big fan of basketball. Livia collecting Harry Styles records. But they're battling something you can't see, a rare type of kidney disease. It's genetic, found in 1 in 20,000 U.S. births, but this type of renal failure is even more uncommon in siblings.
We knew it would end in transplant, but we weren't sure exactly how many organs would be transplanted. You're living in this space of unknown, and it's scary.
That diagnosis came 15 years ago, so the pair have juggled social lives, schoolwork, medication, hospital stays, a true lifestyle change for more than a decade.
I have to drink like a lot more water. I know I can't have a lot of wheat.
Also knowing at some point they would undergo an organ transplant.
It's always been really scary, but my mom has always tried to look at the positives in it and how it will benefit us rather than being scared of it.
Both of them need a new kidney. Maddox also needs a liver.
That has to be a deceased donor, so nobody in the family can test for him. So we're just waiting. It could be any minute.
As you can imagine, maintenance care is expensive. That's where the Children's Organ Transplant Association comes in.
Honestly, we try to stiff arm mom and dad and say, focus on your kids, getting them back to full health, all the things that they need to do to remain intact as a family. And then we'll work with the volunteers to make sure that money's raised to pay for those transplant costs.
CODA volunteers have raised $20,000 for Livia and Maddox through different campaigns, and that money is available to them for a lifetime. A match is expected for Maddox within 6 months, then Livia will go through the same process.
What's something you guys want people to understand?
People look at us and think we're completely healthy, but we are really not at all. We're almost at transplant. But we're really lucky to at least appear like this.
And those two have such a positive spirit, you would never guess that they were going through what they are. But let's talk a little bit more about how expensive this is. That transplant surgery, typically $120,000. Then there's lifelong medications that even with a $15 or $20 copay, often add up to more than the cost of the surgery. For the Venturas, that's ×2. If you'd like to learn more about CODA or even donate to one of Liv and Maddox's campaigns, I'll have a link up on abc10.com/links.